we're going to just talk about certain areas today that are on the face. When you look at someone, you really look at two sites on their face. On the upper face, you look at the eyes. The lower face, what you look at, the center of the eye range, when you look at it, is the lips. So these are two areas that we want to deal with that are really most important to aesthetically improve. And Botox really basically is about positioning eyebrows. And that's what you want to do. But there's other things you can do in addition with Botox. You can get rid of the crow's feet on the side. You put Botox under the eyes to open the eyes. But can you use fillers in addition around the eyes? And the answer is yes. Because what you can do is, you can see right here, she has this little depression between the, fat under eye. It's actually called, some people talked about this and said it was a tear groove or the nasal groove. They gave all sorts of names to it. And this is that little depression you see right here, which is really the area where the fat from under your eye is separated from where the cheek, or the nasolabial fold begins. And to tell you what causes this, sometimes you can't. People who have, asthma or hay fever frequently have darkening in the site, and frequently you see it when people have had a lot of fat removed from under their eyes. And you see it as the fat also descends down as we mature. So you want to really make that look more uniform. You want to make that with an increased volume. You want to bring everything up to the same level. So what we're going to do is use some Juvederm, and we're using the 24 HV. And we gently put this needle in here, just bear with me, and we gently inject it. Now we're injecting it just right under the skin. Now we see right here, now just go with me, and what you want to do is remove the needle as gently as you inserted it. And what you see right now is you see a lot of that area having gone away. And so we stretch the skin, you have a firm surface to inject against. And what you want to do is just place the needle just gently under the skin, and you want to see the material flow. Now, a lot of people will inject this deep to the muscle, but I'm not a depth injector. Basically, what I believe in firmly is going ahead and putting in exactly what you saw. I'm going to ask you some questions, Marilyn. How much does this hurt?
I can't feel it.
You can't feel it. So it's not a very painful procedure with this hyaluronic acid, correct?
Right.
So we're just going to tilt her a little bit laterally, and we're going to go and just put a little bit of this right under this laterally. But again, the rules are hold the skin very tight, inject it very slowly, and remove the needle as gently as you put in the needle. And if you look in the mirror, you'll see that a little bit more of this you'll need right underneath there. And what you want to do is put one level right underneath it. So you want it a little bit right there. And see it's flowing gently under the skin. And I've never seen the blue Tyndall effect that people talk about from putting it here. And I think that's from using the amount of material that is placed under the skin. Well, let's take a look, and you can see that the area from under the eye and the cheek are now almost uniform. So what we do is we're going to put a little more right there, again going in gently, and never ever rush. Because when you rush, you run into problems. But again, gently stretching the skin, placing the tip of the needle under the skin, and injecting it as gently as possible. But the thing is, I'm always slightly hesitant sometimes to repeatedly inject. But again, what I do is I pull the pressure on the skin, I put a whisper right there, pull out as gently as we put in. Yeah. And when people say you're going to see bruising all over, if you go gently, you don't see the bruise. Now, the other thing you want to do is you want to elevate her eyebrow a little bit. So what we want to do is give her a mild elevation of her eyebrow, okay? Because this will bring her eyebrow up. Now, you can elevate the medial and lateral eyebrow with Botox by putting some very superficially under the skin, contiguous with the eyebrow itself. You pull up the eyebrow, and you'll see that she gets a nice brow elevation by doing this. And all this will do is further enhance the frame of her eyes. You've enhanced the framework of her eye. How much did that hurt? You didn't feel it?
No.
Are you surprised?
No,
Why?
because you're good at what you do.
I have to be the best. I have no choice. But you know what? You have to be gentle with patients. You have to treat them like treasures. And you have to take time with every single patient. I mean, that's what you want to see. You see how we elevated that eyebrow? You see how we opened your eye? Well, we've just done it on one side, and we're going to repeat the same process on the other side. And basically what we're going to do is we're going to reproduce the volume between these two areas of our face. Because remember, one of the two centers that you look at in the face are the eyes and the mouth. And basically the eyes, when you look at it, you don't want to see this depression right here. And frequently you see that because fat has descended. You can also see that people have had the fat removed from under their eyes. And you want to get rid of that. You also can see that in people who have asthma or hay fever, when they have a darkness under there. And people talk about something called the Tyndall effect with the hyaluronic acid fillers, but I don't think that's related to where you put the material, because I've never seen it. I think it's related more to how the material is put in as much volume, because I don't use large volumes. So if you want to fix this, you want to put your head back and just relax. And the most important thing to do is to stretch the skin right here. And we first had her tilt forward so we would see all these areas, and then we put the little point of the syringe under the skin. What's important is to pull back on the skin as tightly as possible, because that will give you better flow of the material. Now let's tilt up a little bit right here, and we see that we fill this all right in here. And these are areas you have to be very cautious of. Because when you're under the eye, there are vessels that you can't see, so you want to go very slowly. You want to place the needle very gently. You want to fill this volume very slowly. And you have to do these procedures very slowly. If not, if you rush, your work will not be up to what you want it to be. So let's take a look at that right there. And I see right here is where we need it again. Now, across my left shoulder is Mitzi. Mitzi has worked with me for 25 years. I would tell you one of the most important things when you do any procedure of this type is to have 4 sets of eyes, because you can't see things at a distance when you're doing it. And people who do this very quickly, or don't pay a lot of attention to it, will not do the result they want. But you see, we haven't really gotten a lot of bruising. We put under a large amount of material under the skin right in your eye. You see the material follow up and flow into these areas. Now, the rheology of this Juvederm is much different than, let's say, Zyder or bovine collagen, in that it doesn't flow as well under the skin. And again, when I go over here, I always go in this direction. I don't go down, because that's when you run into a greater chance of hitting blood vessels. I put it like that, have flow in a horizontal injection pattern like that. Just do a little bit at a time, like that. And that way I get much less bruising than if I would stick the needle down and flow it down the cheek, okay? What we're doing now is raising this eyebrow. Again, you can elevate an eyebrow medially and laterally with botulinum toxin. But here what we're doing is putting the Juvederm right above the brow and elevating the brow in the fashion that you see. It is pulling up the brow, as you see. Here we go. I frequently travel around the world injecting, and I think that I will not inject unless Mitzi or a nurse accompanies me, or another nurse. So what we're doing is raising our eyebrow in a very gentle fashion, again using the Juvederm 24 HV. And HV does not refer to high viscosity with the Juvederm. What it refers to is the presence of free hyaluronic acid in it, so it has a better flow characteristic. Now, do you feel that you have better vision when you open your eyes now?
I don't feel the pressure.
Heaviness. Do you want to know why? Because we elevate your eyebrows so you don't feel the pressure. Now, over here, we can see a few little lines right here, but it's a very, very tricky area to inject. You see that right there? Look at this right over here. We see these areas that are very tricky to inject because you want to increase the volume between this. But if you see where the vessels are, you go lateral to them, which I'm going. You can flow into that area as long as you don't stick a needle there and go in there. Now remember, when I did her under the eyes, I went just under the skin. I did not go under the muscle at the bone where people frequently go. And I've really convinced many plastic surgeons, including Michael Caine, who's written about it, to do it in this manner because they don't get the bruising that's frequently associated with injection. Now you can see that we got rid of that depression that was right there. I mean, I don't know what to call this because I call it a little bit of bright eyes because that's when we fill the volume under the eye. Because when you look at people and you look at their face, the two areas that the eye catches is the eyes and the lips. And about the eyes, frequently people have depressions under their eyes as they mature, frequently from the descent of fat. You can have them because you have a history of asthma fever where you get some discoloration. Or else you can have them because you've taken out too much fat. But that area makes your eye area not really that visible because you begin to focus on the depression under the eyes. Additionally, what happens as you get older is you get ptosis of the eyebrow. So your eyebrows fall down, and basically what happens is you don't have a great distance between the brow and the eye itself. So the key thing is to try to elevate the brow. Is there a way non-surgically to do this? And also to give a person a brighter look under the eyes by filling in the loss of volume under the eyes. And sure enough, fillers have really shown a great response in this area. Because you can fill in the volume under the eye by using the judicious use of fillers, and also you can put a small amount of filler above the eyebrow, and then what it will do is pull the eyebrow and increase the distance between the brow and the eye. And now, having done that with you today, what do you say? What does it feel like?
Feels good.
Is it increased your ability to open your lid? Has made you less heavy at the brow?
It feels less heavy, yes.
So, I mean, that's one of the greatest things, because frequently when you use Botox alone above the brow, you get a heaviness of the brow. You don't want that. Basically, you want to elevate the brow, because these are the frames that go around the eye. When I began doing all these procedures, there was no site on the face that I really didn't begin to look at. And one of the sites I really looked at were the earlobes, because as a woman aged, I would see them wearing these really nice earrings, but they didn't really stand up straight, but they would start dropping forward because there was a significant amount of tissue loss in the earlobe, and the holes kept moving down as they kept wearing earrings over the ears. And they frequently re-pierced the earrings and had them sewn up and this and that. But I thought if I could increase the bulk of the earlobe and make it look more youthful, it more would centralize the position of the earring on the ear. Have you ever had this ear re-pierced? Yeah?
I have.
How many times have you had it re-pierced?
Once.
And why did you have it re-pierced?
Because the hole got too big.
The hole got too big and it got too low.
Yes.
Now, are you happy with how it looks now?
No.
You're not. So you did the surgery, did they not?
They did.
And they didn't really put it right. So let's see if we can do a simple thing to your earlobe to reposition your earring. So you can see that she's lost tissue down at the bottom of her ear because you see the wrinkles that have formed, okay? So we're going to use the 24 HV now. We're going to use it with a 30 needle so we can get more volume in here. And you're going to see what we're going to do is return volume to her ear. We're going to go ahead and increase volume in this whole ear. So we want to go through this and go through this in a semicircular fashion, just like we do right here. How much does this hurt?
I don't feel it.
That's a good thing. And we're going to go right here and we'll put a little more volume in. Again, I pinch the ear with my opposing hand so people don't feel it. And also what you do is you go ahead and you keep adding volume. So now we're going to go up this side right over here. Bear with me right here. Put it right here. And what you're doing right now is you're returning the volume that has been gone from the ear over a period of time. And I think this is something that really, women frequently have, a large, beautiful collection of earrings that frequently they don't wear that much, the studs, simply because they will fall down. So let's begin to look at where it's going to sit now. Because the earring is going to sit much higher here, but you want to increase the volume all throughout here also. And we're going to just put a little drop right here. The key thing is to go very slowly and also look very carefully that you keep the volume of the ear correctly, but you also want to make the ear so that you have the fullness under the ear. Again, you can massage this just a little bit because you want even distribution in your ear. So this is what the return to volumetric enhancement is, using a little bit of filler in the ear to judiciously increase the volume present in the ear. So this is something that I just passed by. I did one day, and I didn't realize what it would do, but everyone seems to be quite happy. As people age, their ears begin to look like Pluto. So I wondered if I could just increase the volume in the earlobe to a much more volumetric site. And basically right there. And so we want to go right underneath it. And here again, I put it over my hand just as you see it. I just get basically under the skin. And I would say now we want to go up over here. And so we're putting this again, holding the ear between your thumb and your first finger, the opposing hand, making pressure on the ear, and putting it in so we get a volumetric enhancement. And we can also do, if someone had a face that, particularly nowadays, they're injecting the scars because people don't want to see depressions to the face of scars. So there just is a myriad of places you could really inject, if you had to look at it, to make people look better. Because oftentimes when the scars get bad from a facelift, it limits the way certain people can really wear their hair. So that's all there is today. You see, we've done this earlobe, and we've really enhanced the volumetric position of it, and your earring is going to be much more well-positioned, and you're not going to look like an animal from Walt Disney anymore. So when you have pierced ears, I mean, don't run off and re-pierce them if you think they're wrong and have them sewn up. Because when you did it, well, you weren't happy with it, were you?
No, my ears still hung down.
But they don't hang anymore, so this is getting rid of the Pluto effect of the earlobe. You look great, you work great. I'm glad I didn't hurt you, and thank you very much.
Thank you.